So this is the scientific board of today, and then we will, for a couple of minutes, in 1 hour, I think, we will speak about a little what is behind the skin perfusion range. For some of you that you may not know what is skin perfusion range. It is a range that is behind the interventions and the procedures, aesthetic procedures. So it is not a product that you can find it easily, for example, in the pharmacy and parapharmacy. This is really, problem-oriented products that the doctors, they can use it beside the other interventions, because we were in a very wonderful session now for IMCAS, and you know that the skin cells, they are the living cells. So even we do some interventions on the skin, we should not, put them aside like this, and we should follow them with the cosmetic, but the good cosmetic products. So what is the specification of the skin perfusion? Is a complete range with special ingredients, adapted protocol for each skin concern, targeted penetration, and you will see that we have done something very, very interesting for the penetration with the team of Professor Monfett with Raman spectrophotometry. And this range, they have the precise performance and safety analysis I will show you, and a special ex vivo and in vitro studies, personalized home care protocols, and adapted with aesthetic procedures combined protocols. So this is the retail range. This is all of the range. The tick, the very green tick, it means that I have done, and my team, we have done the very nice clinical trials for each of these products of the range. And this is the cabin range, and even for the cabin range, we have the clinical and safety data for each of them. So what is the specific ingredients inside? We have glucoconolactone, ceramides, retinyl palmitate as the retinoid-like molecules. A cascade of the vitamins that they are good for the skin, like the niacinamide, vitamin B3, vitamin A, B5, C, vitamin H or B8, hyaluronic acid as the core of the formulas, and we have the other ingredients that they are, each of them we use for a specific orientation. So as you can see, we have the range for all of these skin concerns, for hydration, imperfection, hyperpigmentation, wrinkles, firmness, sensitivity, and irritated or post-procedure needs. So targeted penetration. We have done something interesting. This is the photos of, the Raman spectrophotometry that you can see that, for example, if I would like to have a special penetration in the superficial dermis, this is the case of our Time serum. We do this and we prove that it can penetrate in this target, layer. And for example, for Hydra serum, that is a product most superficially should restore the hydration content of the skin. This is the images, and this is another product, B3 recovery cream for the healing and repair. So we need the cream to be really in the superficial part of the skin, like a Pansman, and because of this, we use all of these high technologies to do this. For our studies, what is our evaluation method? It's based on the investigators or the subjects base. Investigator base is divided in two parts, is the instrumental base, or we do it, the clinical scoring. You know why? Because maybe some of you did, when we have the instrumental, we don't need to do the clinical scoring. It is very important because even we prove that there is, for example, an improvement in the depth of the wrinkle with the device, and the patients, they do not have any impression for this, it is not good. So we compare all the time something that is visible, and this is three types of evaluation: instrumental, objectively photographic scales for the investigators, but the blind investigators, not blind investigators. There's investigators that they didn't know how we randomize, for example, the face. And the last one was the patients that they answers the questionnaires. So what is the methods that we use? This is the, I think that is 10 times more than this, we have the devices, and I'm honored to be the editor of the textbook of biometrology of the skin that it contains 1,700 pages. So there are many, many devices, and we can choose these devices according to our needs and according to the things that we would like to prove. So, for example, I give you an example. For example, for color of the skin, we have this sphere. This sphere is not only for the skin. It's every object in the nature, they have a point in this sphere. There is 3 axes in this sphere. One axe is between black and white. It is the luminosity of the skin. So when we have the augmentation of this axe, it means that the subject or your object or the skin is lighter. So the second one is between green and red, and it is for the indicator for erythema. And we have another X between blue and yellow, and this is LAB system. So it is a very well-known system, and you can see that there is not brown in this category. So the scientists, they do something interesting for us, and this is the brown. This is the ITA angle that they calculated with a formula between B and A parameters, and by this way, when the angle is augmented, it means that the skin is lighter according to the brown color. So we used many digital and photographic scales, and also some published complexion like the Mousnier Cell BT Mousnier photography. We are very, very in the standardization of the evaluation. Look at it. This is evaluation of investigator. We use normally the Evalux table. This Evalux table, every time that the doctor evaluates, the distance between the doctor and the patient is the same, the lighting is the same, the position is the same. So they do the evaluation in the exactly same position. And the patient later, it's a driver. We can put the mirror inside, and now in the same position, same lighting, same distance, the patient do the self-evaluation. So we are very in the standardization of the measures. So I give you some examples for some products. For example, the HAB5 Hydra Serum, that is a wonderful serum for preparing the skin for the energy-based devices, because you know that for most of them, we need a good content of chromophore of water in the tissue, even not light-based devices. For the other energy-based devices, and I would like later to know the idea of Dr. Martin Kassir also for this. And we proved that by 1 month's utilization of this serum, we can augment the content of the superficial layer of the skin. It means stratum corneum by 30%, and the deeper, because we use normally the different devices to measure the hydration level in different layers of the skin. And as you can see at right, the photos, why the photos you have some wrinkle improvement? Because we have some wrinkles according to the dehydration of the skin. So these types, not all of the wrinkles, but the dehydration wrinkles, you can improve by these types of products. The second things, for example, we have a glycopil mask with 15% of glycolic acid, and with the machine, the name is Proscope, and we can measure the number and also the diameters of the pores. And as you can see, this is the data, and you can ask if you want the data on the brochure. For the bright serum, this is a product based on the phytic acid, papain, and vitamin C. And normally the patients use it twice a day, and we prove that it is a product to improve the complexion uniformity of the skin by 44%, and the skin radiance by around 20%, and the spot pigmentation diminution by 42%, 42.7%. And here, the Retime serum, that it contains a retinol-like molecule, retinyl palmitate, with hyaluronic acid and a Botox-like agent. And this is for anti-aging product. So we have the diminution of the crow's feet wrinkles around 17%, and augmentation of hydration, because you know that the retinol and retinol palmitate progressively they can improve also the hydration level of the skin. And for the lifting, you can see in the picture, sometimes these types of changes we do not have in the filler injection. And why? I would like to tell you that it is not all for the products, it is also for putting, when you're putting the creams, you do a massage, and this is the mixing of it. As a scientist, I should tell you that. And as you can see, the results after 2 months of application, we had the 20% of diminution of and decreasing of the sagging, and 30% augmentation of 40% almost of elasticity. For the HXR eye cream, for example, for the eye contour, Global Care, we had the diminution of the eye bag, and the applications normally is, for 1 month, twice per day, morning and evening. And for the dark circle also, the formula is for this, is produced for the dark circle and eye bags. And the Lift Booster, this is the Intense Firmness Skincare. So it contains elastin, collagen, and resveratrol. You know that resveratrol is a reference, molecules for lifting effects. And we had also the very nice results on the neck. It was surprising for us because this booster, it was not due for the neck. And all of our studies, it was on the face. And some of the doctors, they came to us and they told that this is a very wonderful effects on the neck. So I added another study to test the effect on the neck, and it was really surprising for us, these effects on the neck. So another types of study that I've done that I love it is the evaluation of antioxidant effect, and how we can do it. We use the explant because you know that ethically we cannot irradiate the live patients and subjects in cosmetic particularly. So we put the skin and then we irradiate with UVA and UVB, and one piece of the skins we protect with this product, and then we measure for example, the stress oxidative markers like H2O2. And as you can see, for example, from control, we had 52% of augmentation after irradiations, and for the skin that we used, our products, that is I think that Bright Serum, it was, for me, it is wonderful because the level of the oxidative stress is lower than the control. So it means that if you do not have the UV radiation also, it can help you to remove this content. So we have a complete brand. In this brand, you can approach to different, problem of the skin. For example, sensitive skin, oily, blemished skin, brown spots, skin sagging, wrinkles, dull skin, and also dehydrated skin, and post-interventions for the irritated. I named it as S, O, B, G, W, D, H, and P. And as you can see here is the crossing protocols. What does it mean? It means that if you have some, combined problems, so you can start. I will give you an example. If you have a sensitive skin with wrinkles, so you should go, this is the pink one and the turquoise one, the blue, green. And you should start with treating the sensitive skin and then going to wrinkles. If you have, for example, sagging skin, the G, in the horizontal one, the violet one, G, and for example, you have the oily skin, so you should treat the oily skin and then going to sagging. So this is something very nice for you, and you can go and you can use the previous table also for this matter. So thank you so much for your attention, and now I will ask my the next persons.